I drilled two small holes through both sides of his skull while he was awake. And the reason I was keeping him awake is because I was performing a procedure called deep brain stimulation. This patient had Parkinson's disease, and it gave him a movement disorder so severe that it was destroying his life. So my plan was to insert electrodes through those little holes in the skull, deep into his brain, and hopefully improve his movement. I started with the left side. I inserted the electrode, and sure enough, when I asked him to lift his right hand, it was completely still. It worked equally well on both sides, and the patient went on to have a much better life because he could move smoothly now, where before he was just racked with tremor and rigidity. So this is Parkinson's disease. This is one of the end stages of it. And what's interesting about this patient is that when he first started developing Parkinson's disease, he lost his desire to smoke cigarettes. He had smoked his whole life. And as soon as the Parkinson's symptoms set in, he just didn't get any reward from smoking cigarettes, so he stopped. And this is something that has been observed over many years and in epidemiological studies is that patients who develop Parkinson's disease don't smoke. So they thought for many years that smoking and nicotine protected you from Parkinson's disease. And now this is a myth that goes around the social media circles that nicotine protects you from Parkinson's disease. But they did a clinical study, they did a clinical trial actually, that showed that no, actually nicotine and smoking does not protect you from Parkinson's disease. In fact, it makes it worse. But they did discover that deep in the brain is an area called the substantia nigra, and that's the area that deteriorates in Parkinson's disease. Well, just in between the substantia nigra is another area called the ventral tegmental area. And this is the area that nicotine stimulates to send reward signals to your brain. So when that area deteriorates along with the substantia nigra in Parkinson's disease, people lose their reward for smoking. And if there's no reward for smoking or using nicotine, then you stop doing it because it costs money and it's kind of a hindrance and it smells bad and makes the whole rest of your body fall apart. So almost all Parkinson's patients stop smoking. I talk about this and much more on a new podcast I did called the Dr. Kumar Discovery. The episode is on nicotine, and it's titled, Why This Neurosurgeon Will Never Use Nicotine. If you're interested, you should check it out. I tell some stories and give you all the data to make good decisions on whether or not you want to include nicotine in your life. It's not a biohack, guys, by the way. It's generally not good for your health, and I lay out all the reasons why. Cheers.